And Todd, do you have your Facebook up to see if everything's running?
I will. Yeah.
Oh, I gotta bring my Facebook up so that I can share it.
Yeah.
Yeah. Do a watch party, right?
Yeah, what is it on? Where will I find it?
Ultimate Dental CE. Says we're live now.
Yeah, we're live.
Yep. Excellent.
Let me see if I can see Kyle here.
All right. We're here, Virgil.
All right, excellent, guys. Welcome to our IHDS webinar series. Today we have a super special guest speaker all the way from California, good friend of mine. I'll be introducing him shortly. But before we get started, I want to say that you guys make sure you register at www.ihds-ce.com so you can receive your free CE. And if you guys have any questions, just send us an email. But anybody that registers will be receiving the CE afterwards. Also, Todd, in a little bit, will be talking about, or actually after the webinar, about upcoming courses as well. We've got an amazing course coming up June 5th that Todd will talk about. But let's get started. So I want to introduce first my co-guest here, who is Todd Scheyer, somebody that I've known for a few years already. And a very good friend of mine, incredible periodontist, clinician, practitioner, researcher. I'm very fond of him and very grateful that he is a mentor of mine as well. He's a partner at IHDS. He's going to be conducting this interview with our speaker. And our speaker today is the one and only Kyle Stanley. I want to welcome Kyle.
Thank you.
Yeah, I want to say.
Thanks for having me.
Sure, it's our pleasure. I want to start off by going over the long list of all the attributes that my friend Kyle has. So I've known Kyle and I've been following Kyle for about 5 years now. It's somebody young, hip, cool that I've been looking up to. He's got an incredible repertoire. He studied under Pascal Magnier. He went to Brazil, to one of my favorite cities in Brazil, Floripa. Amazing place, and he was there for a few years to become an implantologist. Actually, he learned Portuguese specifically to go to Brazil and become an implantologist, which is already incredible and amazing. And he's a wealth of knowledge when it comes to aesthetics, when it comes to implants. So it's kind of my passion as well. So I really look up to Kyle.
Thank you very much.
Of course, man. He's also part of the Guide Institute. He's been working with Sasha since 2011. We were just talking about that as well. He's now currently collaborating with Thomas, also with the Zero Bone Loss Concept. Incredible. They've got really cool courses coming up as well. He works with Bruno Pereira also with Facial Flow. He's a Nobel speaker, DSD instructor speaker, part of the Orofacial Club, one of the innovators when it comes to lip factor as well. He's got this really cool, incredible company that's starting up with AI. He's also part of Slow Dentistry. He's an implantologist. He's a speaker. He used to be a model as well back when he back in the days. I've seen some clips, a dancer as well. He's a father.
Jazz, man, jazz.
Yeah, he's a father and a Porsche fanatic as well. So I hope.
Yeah, you summed me up there. That's everything.
Okay. I hope I didn't miss anything, man. But it's an incredible honor to have you here. I think this topic that you're going to talk about today is extremely important. Something that very few people talk about. And I'm very happy that not only do you have a lecture on this, but you devote time, regardless of the topic that you speak about, a few minutes to address this very, very important topic, especially during this times, Kyle.
Yeah, it's the topic of this oral facial treatment planning and the lip factor, like we said before, was something that I was just always really interested in, and I saw nobody was speaking about it. And so in dental school, I started reading plastic surgery research and psychology and the study of beauty when I was supposed to be studying, teeth and crowns and things like that. And I just, my passion went towards that. And, I've been speaking about this actually since 2009, if I remember correctly. It was actually 2010 when I was still in dental school. My first lecture about this was actually in dental school, and everyone thought I was insane for until 3 years ago. And then all of a sudden, people started to catch on and think that it was kind of cool what we were doing. So it's nice to see it go full circle.
Oh yeah.
Yeah. Yeah. I mean, it's really, it's brilliant, but as you saw it ahead of the game, like most of the things you've done, it's so critical right now, right? This day we're living in right now with digital design and the marriage between all the different components of dentistry, and high level in an environment that's ultra competitive. I know you're in Beverly Hills, right? You're in Beverly Hills, California, amongst a lot of the upper echelon of physicians and plastic surgeons and cosmetic dentists and specialists in dentistry. And then to like Virgil in your introduction, basically he hit all the nails right on the head. But I would add, as someone that I guess is the old guy on the call, we were just talking about my time in residency in the late 90s, looking up to some of your mentors, but they were really continue to lead me and inspire me. And some of them are older than me, some of them aren't. And nowadays, to be able to get inspired by Virgil and you to keep us going and keep us really pushing ourselves to do better for our patient, right? To be having patient-centered outcomes, whether it's research or not, that's really what I think, you, Kyle, stand for dentistry, and especially for a restorative dentist, right? From a specialist like myself, talking to guys like you and others that have done such a wonderful job influencing dentistry, it's putting it all together and delivering a very high level of predictability in a controlled way where your patients appreciate it.
Yeah, it's a hard thing, because to do this orofacial type of treatment, you kind of have to know a little bit about a lot of things. And Christian always talks about the super specialist and how many people are going towards super specialty, and he always goes back and says, no, we need the super generalist, actually, because the super generalist is the one that makes the right referrals, gets
Yeah. Yeah, I agree. I think for me, and the type of dentistry that I enjoy practicing is like this. It's, I don't want to use the term super generalist, but it is. It's a very comprehensive, interdisciplinary type of work. And it's super in the sense that we really enjoy and have passion for a multidisciplinary type of implementation of the things we do. I love perio, I love pros, I love implantology. I'm just a general dentist, but I have a lot of passion for this, and I feel that I need to understand like Kyle said, a little bit of pros, a little bit of perio in order to maximize my implantology results, you know? And if I want to maximize my perio, I need to understand pros much better. So it's a never-ending journey for me, and I love being surrounded by people like you guys that continue to influence me to take different courses, to go outside my comfort zone, and really develop a passion for my everyday dentistry. I think this has helped me a lot enjoy and see dentistry in a very different way than just basic dentistry. Mm-hmm. Mm-hmm. Yes. He does. Oh, yeah. Let's see. Let me see. For Kyle? On Facebook. Let me see. Let's see. Give me 1 second, guys. Let's see. That's better. 1 second. Should be working.
It was working, and it just said it just went out. That's what I'm getting, like texts from a bunch of different people. So maybe you just should tell them real quick. Everybody, we have a sound difficulty. It will just be a minute.
Let's see that.
Should we start and come back? Or stop and come back?
I think we're going to need to start up. We just need a reliable source to tell us.
If the sound
I'm
is
getting
back.
right now. They can only hear Virgil, so you need to just tell everybody that we're going to start up and figure out sound.
All right, guys. So sorry about the sound going off, but I'm gonna restart and then check if the audio is back. All right. I'm gonna end the live. It's on again. It's on. Kevin, can you hear Kyle as well?
Hello. Check.
I think we're back.
We're good?
Yeah.
Okay, yeah. So, hey, if you don't mind, I'll just hop in right here and catch everybody up to speed. Some of the viewers said they heard us for a while, and then they could only hear Virgil, and then we've heard a lot of different things. So what we're going to do all up in 5 minutes on our last 20 minutes is Virgil and I have really been enjoying a conversation about all the stuff that he's done for dentistry. And, you know, the Kyle is an inspiration in dentistry that has brought something so unique to dentistry, and that is the lip factor and how that evolved into Orofacial Club and a lot of other stuff that he's going to tell us about in a moment. But the bottom line is that Kyle is coming to Houston in July, reopen live courses at IHDS. It's going to be so much fun to be able to, you know, give a fist pump or maybe even a hug, you know, to get us teaching again. That's what we all have passion for. You know, Virgil and Kyle are unbelievable restorative dentists that bring excellence on different levels in practice as a restorative dentist, and that as a specialist, because if I could work with dentists like you guys all the time, it makes me better. I'm very fortunate in Houston, a big city, to work with what I think are 30 to 40 of the best dentists in Houston, and it makes me better, right? And that's what guys like you do. I think that, you know, what we've talked about so far is really just that, you know, that we're passionate about this. We have unbelievable mentors that have gotten us to, and our passion really is to realize that the digital workflow and the facial design and all this is reality. It's no longer just for show or for a lecture. It's what we do every day. Want it to get better. So Kyle, take it away. You were just talking about, you know, where it started for you back in dental school with the plastic surgery literature and all.
Yeah.
Brought this to now it's one of your main things to talk about.
Yeah. So kind of to sum that up, I was being taught to treatment plan old lips and young lips the same, and old mouths and young mouths the same aesthetically, and I guess functionally too. And I saw a problem with that. And so I started to see if there was a way that we could think outside of dentistry and possibly move or augment the lips to be in a more aesthetic correct position before we started to do our traditional treatment planning. And that was where this idea came from, was, you know, why spend all this time and money and, you know, pain and uncomfortableness to get to an 80% or a 60% result when we could get to a 90 or a 95% aesthetic and functional result by doing one little added treatment. And so when I started talking about this and traveling around the world talking about this, people started to catch on. And I think what really helped me was when I was speaking in Malaysia, or no, it wasn't in Malaysia, I was in Indonesia with Christian Coachman, and he caught the last 5 minutes of my lecture where I happened to be talking about this. And then afterwards he came up and said, "That was really good. Tell me about that lip thing that you were doing again." And he really helped me promote it. He introduced me to a bunch of the other guys that are now the founding members of the Orofacial Club, and everyone had something that they could contribute. So what I was talking about before the volume cutoff was Octavio Sintra in Brazil. When I showed him, he was talking about how he was treatment planning where the jaws went based on the lip, but they never had augmented the lips. So for example, if you had a long lip patient, and maybe I may have a case that I could show. Let me see if I can bring it up. If you had like a long face type of patient, here we go.
Lower third.
Yep. Okay, so let me share my screen.
Yeah.
You know, while Kyle's doing that, you know, this is the beauty of bringing Kyle to Houston, and you know, Bill Robbins, one of our mentors, he's going to be coming next year for an all-day course. He'll be online with us in a webinar this summer. You know, what Kyle and Christian and all these people have done for us in Houston, Jeff Rouse, and it's bringing everything together, facial design, airway, and then really getting together with a group of great dentists to learn it, to bring it back to their interdisciplinary perio, ortho, endo, oral max lab technician, plastic surgeons, you know, and should I say lab technician again and again, because that's what really allows us to do this.
So can you guys see my screen?
Yes.
Yeah, perfect.
Okay, so if you look at this beautiful Brazilian patient, Octavio was treatment planning her, and what you can see, let me see if I can pause this. What you can see is that she's kind of a long lower third. Okay, so she has vertical maxillary excess. But when you look at where her incisal display is, her incisal display is actually in the correct position. So she's showing, you know, 2 to 4 millimeters at rest for a young woman, which is the ideal. But when she smiles, she has this hyperactive upper lip. She has a long upper lip as well. So if you were to impact her maxilla, she now wouldn't show any tooth at rest. So you would get her to maybe a more aesthetic position from the profile, but not from the frontal view. So when I showed this to Octavio, he immediately had all of these ideas, thinking, oh my gosh, if I just did a lip lift on this patient, put the lip in the correct position, then I could actually put the jaws in the ideal position. Because he was worried. He was thinking, what am I going to do with this patient? I need to impact her maxilla, but I can't, because then I'll actually make her look older.
Yeah. You know, it's amazing. You point this case out, and, you know, Danielle Ramos, orthodontist, and Octavio have joined our teaching team for Beyond Perio Ortho Limits, which is basically using facial design to help us with the orthognathic case, and even using surgically facilitated orthodontic therapy as a precursor to orthognathic. So Octavio is amazing. When I went to residency too in Brazil, him and Daniel opened my eyes to what we could be doing more as a collaborative team by really getting the oral surgeon and the periodontist and the orthodontist and the restorative dentist all on the same page, including the lab technician, anybody else that's needed in the team. It's this type of case where, you know, perhaps because of the somewhat over eruption of the anterior teeth and a thin periodont biotype, that this patient could be improved biotype wise with some type of mucogingival therapy or SFOT as a precursor to orthognathic surgery and lip factor surgery. Not that every patient wants that. Matter of fact, most don't. But if you can tell them through the emotional mock-up that this is what you can do for them with the collaborative team, a lot more will do it, because they understand the true value and the power we have on the planning, the emotional side of dentistry, which, you know, guys like you and us and Christian have really, it's been one of the biggest blessings to dentistry, is to think about the emotional side of it.
Yeah. And when you look at her, her face shape is beautiful. You know, she's really attractive. But in the smiling, when she really wants to express herself, is when you see something that is less attractive and really bothers her. Now, she is very much class 2 as well. But so she has this vertical maxillary excess, and she's class 2. So what I never thought of until I met Octavio was that people were moving the jaws by just accepting where the lip is. And that's the whole idea of the lip factor is we don't have to accept where the lip is. We can move it. We can move it up, we can move it down, we can make it larger, we can make it smaller, and put it in the correct position so that we may be able to do more aesthetic and less invasive treatment. So another case, this is also Octavio's case, similar case in the sense that he has a guy, and this guy, if I remember correctly, you can tell kind of by his profile, was sleep apnea patient. So an airway patient that really needed orthognathic for the airway aspect of it. But you see he has this long upper lip and his tooth display at rest is, almost nothing. But actually Octavio needs to impact his maxilla. So the same problem here. How can you impact the maxilla without making this guy look worse? He barely shows any gingival margins during smiling. So again, thinking inside out and putting the jaw in the correct position, putting the lip in the correct position, putting the teeth in the correct position, the gingival margins in the correct position. And you can think about them all separately and together. But the problem is that plastic surgeons knew they could do this. Dentists knew they could do, whatever we do. Orthodontic surgeons knew they could do whatever they do, but no one was ever bringing it all together. So things were happening independently, but never together. And that was this whole idea. I may have another example. There was something I was just thinking of.
And Kyle, while you talk about that, I know that recently there was some patients that reached out to you that you referred to me, and I also have another patient. And so I see this small percentage of patients and where the case is very complex, and a lot of them are looking for veneers because they want to show more teeth, and like you said, even dentists don't understand this concept of, yes, we can make them longer, but that's not really going to make you look more youthful. And so it's a very important topic to discuss with our patients. So I'm glad you're out there and you're growing this lip factor topic, because more and more aesthetic dentists and surgeons need to understand how we can all continue to come together in order to maximize the outcome for these patients.
Yeah, that's a great point.
I think too, Kyle, before you show this case, is that's one of the things that really just in the last 24 months through meeting Octavio and the oral surgeon or orthodontist, they've inspired our team in Houston, orthodontists, prosthodontists, restorative dentists, oral surgeons, to take this next level. So this course that we're involved with will hopefully be successful, mainly for orthodontists, because we need the orthodontic community to understand how digital smile design isn't just a gimmick for Invisalign. It's really using the digital technology with aligner technology, whether you use aligners or braces, whether you use a plastic surgeon, an oral surgeon, a periodontist, it doesn't really matter. It's thinking about all the components of dentistry on one that we can all speak the same language with. And then using that as a collaborative tool to make dentistry better. And that's, I think, the drive home message for us here is that it doesn't matter whether it's digital smile design or others, really. It's digital design and collaborative care that makes dentistry better, and just open dentists' eyes to what you've already seen for so many years.
Yeah, no, it's exactly right. And going off of what Vir was saying before, is just, I was being taught like this. You have a young patient right here, and if she got her front teeth knocked out, we would know where to put them, right? Exactly where the teeth are here. So maybe she's showing about 4 millimeters at rest, which is kind of our starting point for younger, more kind of aesthetic patients that want to look young, beautiful. And then you go to a patient like this, and the problem is that every dental school in the world is teaching to treatment plan these patients the same way. Let's put the teeth 2 millimeters when this patient is at rest. And what you end up doing on this patient is you make this patient look like that beautiful Brazilian girl that I was showing you before. You make her appear like she has maxillary excess. So let's say this patient needs a denture. We would make the denture so tall just to show a few millimeters at rest or when she's speaking. And that actually throws off the facial thirds and the balance with the face. So you sacrifice, the rules that we need in dentistry. We have to have 2 to 4 millimeters at rest to sacrifice the overall aesthetics of the patient. And I just always thought that was wrong. And so this whole idea is let's put the lip, if we're using the lip as the starting point, because the teeth really aren't the starting point, it's kind of the lip. And that's how we're all taught, right? We take wherever the lip is, we add a few millimeters to it. That's where our incisal edge goes. If you're using the lip, let's make sure it's in the correct position first before we start going. Because like a patient like this, what are you going to do on this patient? Because this patient, if they come in and need a denture, he's probably going to tell you, oh, I want to show some teeth when I talk. My grandkids said that I look mean when I talk. And, I see people that smile and talk and they show teeth. So what do? Take their incisal edge and put it way down there. Now they have this vertical maxillary excess. It's a prosthetic vertical maxillary excess, but that's what we've created.
Yeah, and then like you've mentioned it already, and we're super passionate about this, but airway, you start looking at your elder patient that's ready to do a reconstruction. They've worn their dentition functionally with a healthy joint and healthy periodontium for decades, and they need to be reconstructed. Are you going to reconstruct them without looking at their airway today? I mean, let's hope not, but quite honestly, Virgil will tell you that it's pretty scary out there right now with dentists that want to go learn how to place implants, but they never really thought about the airway.
Yes.
Yeah. Airway for me has been the last 2 years. By no means am I an airway expert, but I have seen the importance of it so much. And why I really got into it is because my mom has restless leg syndrome. And so I started to look into this, and I found research articles saying that it can be linked to airway issues. So I delved into this because I want to help my mom so much, and we're still in the process of trying to help her. But this is what got me really excited about it. And now, everything in hindsight, you start looking at things and saying, okay, if you're doing, like you're saying, immediate load, and you're making a super thick prosthetic, how are you impacting the airway space there? Where's the tongue going to go now? Because I always thought, well, okay, if I make it super thick, they may not be able to talk. And that was kind of the only thing I was worried about. But so much bigger is the general health of the patient.
Yeah.
How much oxygen are they getting a night?
Especially in the way we do it, right? We hack off a centimeter of bone and put their maxilla back to where it's not supposed to be and shorten their airway, put their tongue back there, reconstruct it out of all zirconia, and let them smash their implants out of their mouth. I mean, unfortunately for me, having done this for over 20 years now, I've done immediate load since 1998 in the mandible mainly, but immediate load back in the Cochrane, Lyndon Cooper, Clark Stanford days of doing the first 4 all-on-4 in the mandible before all-on-4 existed. We had tremendous success rates, but if we started looking at our cases as we went further on with the maxilla and immediate load, even if the implants were still there and the prosthesis was successful, issue died back that if you didn't have a flange or something to protect the aesthetics of your smile line, we get these patients, and I can say that very comfortably now because I've been doing it long enough, but hey, as this pendulum swung towards so many people thinking that they're teeth in a day experts and can do it in the maxilla because that's what the patient wants. They want an immediate smile in the maxilla with facial aesthetics and the right lip and incisal edge. Well, yes, you may be able to do that after a course or two, but do you understand the airway and where you're setting these teeth and how you're handicapping their tongue space and all that? And that's I think where guys like you can really shout from the rooftops, because a specialist saying it sounds condescending, but for a restorative dentist to say it, it's real, man. It's real, and these are patients we're treating. They're not just people. They're just not another number trying to be sold a car.
Yeah. For me, I think I was going to say, for me, I think some of the failures that I've had are undiagnosed airway, because that's something, like Kyle said, I'm new at it. I just started getting into it a few years ago, and only because I couldn't understand why these textbook cases that I was doing, I was getting the prosthesis to fracture, and it was the undiagnosed aspect of my treatment. And for me, that was airway, and how important that is. Now I'm lucky that I have Todd on my side, because he's an expert on this, so I'm trying to learn as much as possible from him.
Yeah, it's the whole thing, and that's what we all, I think, have a duty to do, is to help dentists out there, think about the airway first. And then like you said already, Kyle, right, that if you start thinking about restless leg syndrome or nutritional issues, or actually, quite honestly, chronic issues that almost every U.S. citizen has, tie it back to their airway as a child and how that helped them during growth and development, ADHD, growth and development, acuity, schooling, functioning in the daily society with depression and things like that. Look at just depression and restless sleep and all those things and how that relates to human beings. And man, as dentists, we have this great opportunity to help us, at least help the dentist be a bigger part of this game, to understand it, to do better dentistry and protect our failures. But they knew that all of us really cared about them and their functional health, then dentistry would rise up, and I think with COVID going on, if we can have more dentists like you guys shouting, we can be more focused on airway focused dentistry and planning and anesthetics, because what you have here with the Lip Factor and Orofacial Club, that's the icing on the cake. That's where we can now come back to the patient with that emotional side of dentistry to offer something that they want. We can worry about the airway, we can worry about functional health and biology, but it's them that really wants this aesthetics.
Well, you bring up a good point with sleep and childhood problems, in the sense that a lot of people, when I first started lecturing about this, everyone just said you're insane. Then when I guess sleep dentistry kind of started getting some traction, let's say maybe 5 years ago, I would lecture about this, and there's always like one sleep expert that would come up to me and say, well, you're going to cause this person to not be able to close their mouth, and they're going to start mouth breathing. And I didn't know the answer because I wasn't asleep at the time. And then when I really started working with Ben Talay, who's a plastic surgeon that I mainly work with on this, and he's actually an ENT trained before he did plastics. And he started explaining, no. Mouth breathing you can't just make mouth breathing happen. This is something that comes from childhood, from not being able to breathe through their mouth. So they have to start breathing when they can't breathe through their nose, they have to start breathing through their mouth. And then one of my friends, who's actually a dentist in my building, used to live in my neighborhood, a guy named Victor Kachaturian. I remember when he told me that, they basically think that ADHD doesn't exist anymore. And I was like, what? This is crazy. And started reading about it, and it makes so much sense to think about this. These kids are in constant fight or flight. Mm-hmm. They just want to sleep. And then what do? We give them speed and, and then wonder why they're all
right. And why they can't pay attention. Some people can channel it, having a child with ADHD, very severe, and probably has some airway, most definitely, as I do, and as everybody does. This is what I think the bottom line is, and fun aesthetic stuff. But the bottom line is we all have airways. They're all the size of our pinky, and they all get worse with age. Throw anything else onto that, a class 2 or a class 3 or a tongue or a septum
or obesity
or whatever you want to alcoholism, you want whatever. The pile of hump, it all begins with an airway, which we all have. If we don't start thinking about the airway, our dentistry is going to get destroyed. Simple as that.
Also, Kyle, I wanted to maybe switch gears a little bit, because you have so many topics that you talk about that are extremely important. But one of the things that I want to focus on, especially because of the current situation that we're in with COVID, is depression. I've talked to a lot of my colleagues about this. I've talked to a lot of my patients about this as well. And it's a very serious problem now more than ever. I know this is a very passionate topic that you speak for and represent a lot of us that don't have a voice, or maybe are too scared to talk about these things, because man, we look at people out in social media posting amazing cases and posting about their incredible life, and even I have some of my colleague friends that say, oh man, you're doing so great, but I think some of them might not understand all the hard work that it takes to do some of these things, and at times I think we might lose the passion that we have for dentistry and then start to veer the wrong way. So In my case, in my journey, I think the thing that keeps me positive and excited every single day is being surrounded by you guys and learning from you guys. And that really brings a shot of energy for me every day, because I truly love dentistry. Somebody said something in a Facebook group that said, if you were to go back, how many of you guys would go back and do dentistry? And for me, it's no question. But many people were saying no. And I began to wonder, I'm like, man, what is the difference between these guys? Because we were all the same in dental school. You know, we all had a vision and we all wanted to do this great things in dentistry. But then things change when you start practicing dentistry. So I'd love to get your insight on this and what you think and what motivates you and what you recommend for those that feel lost to get out of this darkness and to come back to enjoy dentistry.
Yeah, so my story with that is that I was, I felt like at the top of my game. I was traveling around the world, teaching thousands of dentists on the biggest podiums. I have a fancy Beverly Hills practice. From the outside, it looked like I really had everything. And I was ready to quit dentistry. I told my wife, I think I'm going to quit. Can't handle it anymore. Too stressful. And I had patients that had threatened to sue me. I had problems with staff. I was having complications. And I was thinking, am I not as good as I thought I was? I'm going and teaching people how to do stuff. Maybe I'm not as good as I thought I was. And so I almost quit a few years ago. I just said, done. It's too stressful. It's not what I thought it was. And the same way, I'm so passionate about it. I love it. But what I had to realize was that dentistry can be a passion, but it's not my purpose. So my purpose is to be a father, is to be a husband, to be a family man, to bring something to the world that will leave a legacy, let's say. And I kind of don't give a shit if people, when I die, say, oh, he was a great dentist. So that's not that important to me. I mean, number one, I would love to say, he was a family man. He cared about his family, took care of his family. And so once I separated that was when everything opened up for me. So I've actually been spending a lot of time on this project. I'm putting together an online course about depression, suicide, stress, anxiety for dentists, specifically for dentists. Because when I started speaking about this a few years ago, oh my gosh, it was, I got so many calls, texts, DMs, everything saying like, thank you for talking about this, because I thought I was the only one. Mm-hmm. And there's an old adage that we have the highest suicide rate. And so I started looking into this because I'm a researcher, so I went to the scientific research, and it's true. We're actually number one. Male dentists are number one, and female dentists, I think, are number 4. But if you combine us together, we have the highest suicide rate of any profession in the United States, at least. And a lot of the attributes that I started finding, whether it was debt or living in an environment of fear, which is where we are with all of our patients, being fearful, complications, time stress, staff, litigation, all of these things I talk about in my course. I thought it was just something in the US. And then when I started putting things on Instagram and on Facebook, I got people from all over the world telling me it's not just the US. The UK has a very big problem with this. I got people from South Africa and Malaysia and Australia and everywhere, all over the world. So it's something that is within our profession. And I tell you that there's a lot of things we have to do, but the main thing for me was separating passion and purpose. And that really helped me get through this. So like I said, I'm working on a few things right now. I may even write a book on this because I'm spending so much time on this. So it's really been a passion for me. What's interesting is that, similar to the lip factor, I started just kind of sneaking this into lectures. So someone would invite me, I'd go to Nebraska and they'd say, okay, we want you to talk about implant aesthetics. So I talk about implant aesthetics from 8 a.m. to 2 p.m. But after lunch for 45 minutes, I'd talk about stress. And afterwards, that was all anybody wanted to talk about.
Isn't that something? Yeah.
Because what I realized was that you can't do good implant aesthetics. You can't do a good crown prep. You can't do a full mouth rehab if you're not in the right if you don't have the right mental health, if you're not in the right headspace. Yeah. And so it kind of supersedes anything that we could actually do, but no one was talking about it.
Yeah. Well, that's
because everybody was worried that they were going to look too weak. And honestly, I was worried about looking weak too. And why I started speaking about it was selfishly just to help myself. Right. I needed someone to talk to about it. And what better than, 40 dentists in the room that kind of had to listen to me.
Yeah. No, I mean, I applaud you for it, man. I mean, it really takes a brave person to stand up and talk about something that no one wants to talk about. Yeah. I don't want to disclude all the wonderful women dentists out there, like we'll have Tracy and Michelle next week, but think about the male dentist that of the yesteryears, that it was a male single practice owner, right, with a family. Isolationism, no partner, no mentor, really, getting out of school with debt and building their own practice, dealing with staff. Most of our staff, no knock here again, but most of our staff comes from a high school or technical grade education. They're a lower paid employee. They don't necessarily understand the core values that you have. And we've got to lead that team of people that not less than us, but they're part of our team because that's what dental teams are. And then the added stresses of trying to be super successful like you or anybody that has pride in what they do, whether it's research, education, clinicians. And I share this only because for the first time in my life over the past 5 years, as my senior partner slowed down and it was very obvious that I needed to be the leader for a large team and in a stressful job, right? Let's face it, whether it's perio, pros, endo, or whatever it is, I mean, or doing it all, even more stressful for me. I can't do all that, but to focus on a high level perio practice has been overwhelming. So I've had, some of my darkest days in the last, it's just because of stress, right? It's the stress that's driving this thing that nobody really knows what it is. Like, oh God, I feel really crap today and I can't seem to get myself out of it. But 5 years ago, I would have said, screw that. I mean, I'm fine. Just give me another surgery and I'll be cool. But now, in the afternoon, as I'm sure you've heard from so many, in the afternoon after lunchtime, if you're not as focused, you're not as that's reality. And whether it's airway or depression or whatever it is, or if it's all tied together, let's figure out a way to help each other. So, I mean, I can't applaud you enough for what you're doing because there's a lot of guys like you all that haven't quite hit the 48, 50-year-old time frame. And I tell you, man, when I came up on 47, I hit a wall. And it was my airway, but it took that to tell me. Once I treated the airway, I've become a lot better, but still there's days, I think solely because of stress, where the days aren't as good as they could be. And that's a shame, right? We're cheating ourselves. And if you can get more people talking about it and doing things to help themselves, then heck, we'll be doing a lot better for our patients.
Yeah, I really just wanted to sacrifice myself and say, like, I'll be the one who comes out and tells my story and is maybe a little embarrassed, just so that we can get other people talking about it. And maybe those 40 people that were in that study club, if someone was going through something hard, they could call someone in that study club and say, hey, I don't really know you that well, but remember when we saw that guy Kyle talk and, he talked about it, I'm kind of going through the same thing. And when you add in the stresses of COVID, and especially the money stress that a lot of us have very high overhead, whether it's student loans or practice loans or equipment or whatever. We actually had, unfortunately, a female pediatric dentist that committed suicide in, I think it was South Dakota, last month because of all this. So it's still there. It's still there. And COVID only adds more to it. So we have to talk about it. So I'll probably do the same thing when I'm in Houston. I'll probably sneak some of this in,
Please do. I think we want you to do that. And we also want to move on because our time's running thin. And I got a super awesome question for you. And I can't disclose a lot about this, but we've been involved with artificial intelligence on a formal level for 3 years, and we finally have funding for a very significant clinical trial that I can't wait to tell you about when we're in Houston. I'm going to have you sign.
Sounds good.
But with what you're doing, with what we're doing, and some of our friends across the globe, this to me is the most amazing thing I have ever seen in my life, from growth factors to digital to whatever. AI is going to change our globe and dentistry. So let's finish with that one. Man, I couldn't be more amped out about this. All I'm going to tell you, and you're going to love this, just guess what it's called. The Digital Hygienist.
Oh, wow.
Yeah.
That's amazing.
It's awesome. It's already released in Japan. The clinical trial will get it through the FDA. Fingers crossed.
Clinical trials aren't easy. We've been there, and IRBs aren't easy too. So I wish you all the best.
Thank you.
But yeah, AI is. I didn't realize how big of a difference it's going to make in all aspects of our lives, but especially in healthcare. So with my company, Pearl, that we started a few years ago, we are reading digital x-rays with AI. We're also looking at intraoral scans with AI, marking margins. We're analyzing data in patients or in doctors' offices with AI. It is something that will infiltrate every aspect of our life.
Everything.
And it will take away a lot of the mundane aspects of what we do. And it will also bring truth into dentistry. And this is what I think is the most important thing. So when I say truth, it's multifactorial. One thing will be truth is that we'll get to this level where we actually have one diagnosis. That's what it should always be, right? But, if a patient comes to my practice, if they see Virgil, if they see you, they're going to get different treatment plans, whether it's very, very different or just a little bit different. But there really should be one diagnosis, and there can be multiple treatment plans, right? Because everyone's trained differently, they're more comfortable with certain things. But we need to go back to this one diagnosis idea. And that's what makes patients not trust dentistry. If they go to 5 different practices, they get 6, 7 different opinions.
Yeah, and then many are trying to say that treatment plan is a bunch of BS, right? Because they want to sell the case, right? So then backstabbing going on in dentistry. I mean, I couldn't agree with you more there. One diagnosis, or maybe there's various diagnoses, and then there's multiple treatment. Patient has the opportunity to be informed and consented about. That's what DSD has done for me with taking global diagnosis, what Bill talks about, taking global, digitizing and showing it to a patient in a manner in which they accept, they understand, they visualize, and then they ultimately accept.
So Kyle,
so AI will bring that truth.
I was gonna say, do you see an aspect of AI going into the public for education? Let's say them going to the dentist and kind of working with an AI dentist where the patient will be able to verify that what's being told is really what's happening. Are you guys creating this link between not just keeping the dentist informed, but
we're trying to inform? I think eventually the general public will realize that they're going to want to go to a dentist that has AI technology, because like our product is called Second Opinion, that looks at radiographs. They basically get a second opinion from 1,000 dental brains from around the world. So when you take a radiograph, it comes up and it'll make little boxes around diagnoses. And so the doctor can say like, yeah, I agree with this, or I don't agree with this, or it can back you up. And that's one of the other aspects that I like is that, just like Todd said, afternoon, we may be tired, we may be, our wife's calling us saying we got to come home, et cetera, et cetera. We're stressed out, let's say, at certain times. We may miss something. I mean, we're human. And so we have to realize how to apply what we are as humans and what we do as humans in a better way, and what machines are really good at, and have them do that part. So machines are really good at repetitive, standardizing things, recall, precision, and humans are good at artistic aspects. We're good at sympathy, empathy. We're good at critical thinking. So when we can think like a cyborg, and if you guys have heard Elon Musk's interviews recently, he says we're already cyborgs, right? Because wherever you go, we always have one of these around. And if you're not afraid of that, a cyborg will actually be better than us currently, because we have a lot of positive things for us being human, and we have a lot of negative things. We make mistakes. We get tired. Machines don't get tired. And so when you bring those two aspects together, you can really bring trust, limit litigation, limit liability on dentists, which is something that I'm really passionate about with talking about depression and things, because it's a very big cause of depression. And bringing that truth as well into the lab business, because what we have now is, you send something to the lab, they may call you and say, hey, I can't see the margin here or whatever. Or, so let's say they're blaming you in that case. But then if they were to just make it and send it back and it doesn't fit, then we would blame them, right? And so we want to bring this truth into this. Is this a good prep? You should know when you finish a prep if it's good prep. The AI can analyze it, say, hey, you may want to change this margin, make it a little smoother, because then you'll be able to get it marked automatically by the AI, have it be faster, more predictable. So bringing truth into different aspects of dentistry and really having data-driven answers. So that's one of the other aspects that we do, is looking at the data from radiographs. Let's say you have 5 practices, your DSO, or you only have 1 practice. But you may go to your front office and say, hey, how many patients do we have that are in perio treatment? And, Sally may say, I don't know, maybe 40%. Okay, that's just like an opinion, right? But with AI, we can look at every radiograph from every patient and say, hey, Mrs. Jones is not in perio treatment, but she has 3 millimeters of bone loss. Why are we doing prophies on her? She really needs to have perio maintenance or scaling, or et cetera. And there's no opinion there. It's measured. It's 2.85 millimeters of bone loss, whatever it is, down to the 10th of a millimeter. And so again, just brings the truth. And that's what I'm really excited about. In all aspects of dentistry, we're going to have more truth.
Yeah, and I'd add to that too. I mean, you hit it, man. For me, is that bringing the truth out, using analytics and data mining has been what we've been so negligent. When we have all this data sitting at Delta Dental or whatever, to get in there and data mine, whether it's with AI or some, scan on records to help us be smarter and bring the truth out, right? Bring the data, the evidence based on all the decisions we make in dentistry. You're talking radiographs. What we're talking about is perio compliance. If we could change compliance from the standard 37%, a la Wilson and others, and actually move that up a 10%. And I'll finish with this, and then I'd love to hear closing thoughts from Kyle and Virgil. When we started looking at AI, we looked at a very large company that did AI for Toyota, that looked at truck drivers and fuel efficiency and deaths, because a lot of truck drivers in Asia were dying.
They're sleep deprived.
The
airway thing.
The AI probed them through devices and through the motors of the cars and various other inputs. And the misconception out there is that it's robotic, right? It's someone prying and probing. Used for the right intent, the data will make the right decisions, a truthful decision. And whether that's dentistry or a truck driver or whatever it is, Virgil, it's coming, and you need to adopt it just like you do your intraoral scanner. IA is going to change the world we live in, hands down. Everybody should watch The Woven City. Just Google The Woven City and watch it, and think about where we should go. Not because someone's trying to surveillance us and wants to put a chip in our head, blah, blah, blah. Just think about how we make better decisions. Rely on all the things that Kyle said. Humanistic principles, critical thinking that a computer can't always do, compassion, right? Relevance, passion, right? These are the things that we have that will make sure that AI doesn't take us over. A good friend of mine, and you know Brian Vence too, don't you, Kyle?
Yeah.
Brian talks about how we need to be careful of digital dentistry because we still need to live in this analog world that allows us to trust and verify. And I've always been a big proponent of George and Brian talking about trust but verify, and using that old adage to really strike us home in digital dentistry: trust but verify, right? Passive fit, trust but verify. Guided dentistry, trust but verify. Digital smile design, trust but verify. AI, trust but verify. And we have, through your efforts and I think ours, through clinical research, making sure that, for instance, the digital hygienist doesn't put hygienists out of business. No. Or what you're doing with radiographs doesn't offend dentistry. It actually helps them with litigation, right? And doing the right thing because it's based on data and evidence, not just based on some computer you think is going to take over the world.
Yeah, well, that's always a concern with many people. People are like, is this going to put me out of a job? And I'm like, listen, I'm a dentist. My dad's a dentist. My brother's a dentist. I come from a family of dentists. I am such a dental proponent. Like, I want the dental profession to do better. But what I want us to do is be able to focus on dentistry and not focus on
Amen.
missing something, not focus on, am I going to get sued? How do I convince this patient that this is the right thing to do? This is what's best for their health and their aesthetics. And so I think that's where technology is going to help us, and especially AI, is that it's going to allow us to focus on what we're passionate about.
Yeah.
There's very few dentists are like, gosh, I'm so passionate about limiting my liability. I'm so passionate about
HR.
I love HR, right? Yeah.
I
and
love
so like
hiring
little
the 5
things
people
like
that
that.
didn't come back to work right now. Like,
Yeah.
buddies right now. I got a buddy in Chicago, one hygienist and 5 employees aren't coming back. Unemployment's pretty good. I think that everybody out there, sorry, but everybody forgets that unemployment is borrowed money.
Yeah.
Sorry, there's no free rides.
Right.
Yeah.
But it's sad. I think that what we're here doing today, it's been awesome having you on. Virgil, anything else? But I mean, I can't thank Kyle enough. I can't wait for July. We got to make this happen. I'll come get you, man. I'll come figure out a way
We
to
will
come
drive.
We'll drive out in your Porsche.
Yeah. It'd be a fun drive.
Yeah, I'll take a Greyhound out and we'll drive back and solve those problems.
Yeah, I just want to say thank you so much to Kyle for representing dentistry and general dentists and all specialties and everybody involved in dentistry to such high standard, to such great excellence. Thank you so much for everything you do, and for making dentistry a great profession. I really appreciate the time you spent with us, Kyle. And we really look forward to having you here in July so that you can continue to inspire a lot of us out there and continue to make dentistry a great profession. Thank you.
Thanks, guys. It's really been a pleasure, and thanks for all the kind words. I'm super excited to get out to Houston and get some good barbecue and have some fun in Texas. So
awesome.
Yeah.
Thank you so much.
Awesome, man. Appreciate it. You be safe. I hope you get back at it full steam ahead here very soon. And I was supposed to be out with you and Sasha in September, but looks like we're putting that one off for a year. But hopefully I'll get out there next year.
Yeah, let's make it happen.
All right, Kyle. Thank you so much for your time,
guys,
everybody. Thank you for tuning in.
Yeah,
Take care.
Thanks, everybody.
Okay, bye.
Hey, before everybody shuts off there, next Friday, it's 10 a.m., right, Virg?
Yes, 10 a.m.
10 a.m. with Tracy Nguyen and Michelle Weddle talking about airway dentist. It was going to be an all-day course with those two. Their practice open, so we're going to do a 2-hour webinar, and they're going to come back in 2020. We've got great stuff going on in June, so just check it out on Facebook or the website. Register for things like this with Kyle. That allows credit for free and allows us to give you emails about other content we'll be pushing. The biggest ones of 20 are really, Kyle's coming in July, and then the Brazilian and Houston team are going to be doing Beyond Perio Ortho Limits, a 2-part continuum online course in July, and then a live course. Oh, one more thing for Kyle. Sorry, buddy. I'm glad you stayed on, though. Ralph George is coming for a DSD app day the day before we do the Beyond Ortho Limits in September.
Oh, sweet.
And Ralph's going to include the AI part of the app.
Oh, nice. Yeah,
That's,
he was just showing me that stuff.
Yeah, so that's right, Virgil. I mean, AI is already on.
Yeah.
Right? So it can analyze a smile and very quickly allow you to do a design that's AI based versus your talents or your technician's talents in designing the smile, just like that on an app. So cool things coming.
Yeah, amazing stuff. I'm so excited to get that new version.
Yeah. And anything else you want to say about the Orofacial Club? I know some oral surgeons joined us today, trying to really get that going for Houston. What would you say we should do next?
I think the main thing is try to find teams. That was one of the hardest things. That's why I wrote the article in 2010 but didn't publish in 2017, was because I was trying to find plastic surgeons and oral surgeons and periodontists and orthodontists that really believed in this. And so they're lucky to have you guys in Houston as like the center of multidisciplinary treatment. But try to start putting teams together, exchanging ideas. And
so for those that, like, for instance, we have all components: oral surgery, plastic surgeon, craniofacial, ENT, and then all the dental parts in our team. What would you say for us? I mean, we couldn't make it to Miami, but you've told me there isn't another course planned yet. So
we may do an online course coming up soon with the Orofacial Club. Tomorrow we actually have a roundtable.
Yes, I saw the roundtable.
So if anyone's interested in that, you can I think it's on the DSD website. I think once you hear everybody talk from their specific influences, it all makes sense. And everyone just, boom, gets it. And I think the biggest thing is getting the medical community to know that we do something other than like fix broken teeth. Yeah. Because the medical community in general has no idea what we do. Just like, in their defense, we oftentimes don't know what they do as well.
Yeah, absolutely. Right.
And so when you get everybody together, you're like, oh my gosh, you can change that? You can do something about that? Yeah. That makes my job so much easier. I can do less invasive treatment or faster or whatever.
Yeah, relevant. We're talking about from facial aesthetics, facially generated treatment planning, and doing a lot of great dentistry that's involved with that. But I want to circle back one last time that way in there, man. Think about the team that's not just thinking about the aesthetic outcome of facial plastic surgery, but the aesthetic outcome of facial plastic surgery that supports the airway, right?
Yep.
If you can get guys to think about the craniofacial things that need to happen. That was the biggest thing for Jim and me, the plastic surgeon we work with, is he's a facial plastics guy. He does unbelievable plastic surgery, but it's all soft tissue. He said, Todd, we need to involve a craniofacial, and we've worked with some oral surgeons, and they weren't really into the craniofacial. They wanted to do orthognathics, but not necessarily craniofacial. So our team has been strongly influenced by craniofacial plastic surgery.
Yeah.
And soft tissue plastic surgery. And finally, we have some oral surgeons that understand that we're really just trying to bring everybody together. We're not trying to threaten the orthognathic surgeon. Mm-hmm. We're saying, let's all work together and do better, and let's make it airway focused.
That's true. When you get an oral surgeon that is on board with this, and gosh, those teams can really excel. And we've seen that before with some of the people that we've trained.
Yeah. I know you know Rob Relay pretty well, right? He's in your neck of the woods, and he's even influenced us with our education. So with Octavio and Rob and we got some great guys in Houston that are coming on board hopefully this summer for education. But this is the thing. The biggest impediment for the oral surgeons has been their level to commit to education. Get it, right? If you don't have the time because you're on your practice, it takes a certain level of passion to do it. And I think we're almost there as far as bringing some oral surgeons that are wanting to teach. If not, said he can come down from Dallas anytime. So Richard too.
Oh yeah, I love that guy.
All right, thanks for staying late, Virgil.
Yeah. Thank you guys.
Last
Kyle,
words, my friend.
Thank you for your abundance, man. We really appreciate it. We can't wait for you to be here. Todd, enjoy
Thanks, me too.
Everything. Thank you guys.
All right. See you guys. Bye-bye.
See ya.
Bye-bye.
Bye.
Good job, man.
Good job.